Sure. My name is Eileen Callahan. My title is attending and associate professor in the Brookdale Department of Geriatrics and Palliative Medicine at the Icahn School of Medicine at Mount Sinai. Alzheimer's disease is a degenerative cognitive neurologic condition that causes a person to lose not just their memory, but really executive functioning, also meaning their ability to live independently and do some of the things that we all do every day and take for granted. So it is a disease that is progressive and degenerative and is really affects their overall life and well-being. Yeah, we were really limited as to what we were able to prescribe for our patients. The most common one that we would prescribe is something called donepezil, and it goes by the brand name of Aricept, and it was approved by the FDA back in about 1996. And that was a drug that was given by mouth, and it was supposed to work on different chemicals in the brain, neurotransmitters. That was the main one. And then there was another one called memantine that works on a different chemical in the brain. So those are the two major ones that we were prescribing for our patients. Yeah, this drug really is very, very different in that it's supposed to target some of the degenerative changes seen in one's brain with Alzheimer's disease, called the amyloid plaques, these proteins, these things that build up in somebody's brain, usually with Alzheimer's disease. But the confusing thing is sometimes people have those plaques in their brains without having signs of Alzheimer's disease. So this new drug is works against those amyloid plaques to try to get rid of the amyloid plaques. So there's a whole different thinking behind this one. Well, it's just a whole different approach, and ideally it's supposed to give patients, caregivers, family members hope that it might change their disease, not necessarily cure it, but maybe slow the progression, maybe improve symptoms. A lot of maybes there. It really is a whole different class of medications that are given to us now as doctors, and I think it's going to open the door for a lot of other medications in this class of meds. There's a lot of questions that need to be asked, really, because there's a lot of questions that doctors have about this medication. So the first and foremost question is, do I really have Alzheimer's disease, or does my dad have Alzheimer's disease? And that's the big question, that I think we don't have a definitive answer for a lot of times. And that's always been the struggle with these drugs. So I think the first question is, how accurate is the diagnosis, right? And how is that diagnosis being made? It really involves a lot of history taking. So as a geriatric doctor, we spend a lot of time asking a lot of questions, not just from the patient, but from the person closest to that patient, whether it's spouse, the child, the neighbor, the home attendant. We ask a lot of questions to really build a story and get to that accurate diagnosis. We will do some blood work just to confirm that there's no other problems going on. And then most often we do some sort of imaging in terms of either a CAT scan of the brain and an MRI of the brain. So I think getting back to this question is, the first is really making sure there's an accurate diagnosis of Alzheimer's disease. And then there's the questions that follow after that. Well, is it really Alzheimer's, or is it some other form of dementia? Is there any other medical problems happening? At what stage is this dementia? And then in terms of the medication itself, there's a lot of questions here. And the safety, the efficacy are the two big concerns that a family or a patient should have, and ask their doctor to talk about that. My final thoughts on this topic are that there's a lot of questions we all have still. A lot of doctors really, really, really want to take care of these patients and do the best for them. But we ourselves have a lot of questions of whether this is a good drug to give our patients. There are a lot of answers that we're still looking for in terms of what really is the efficacy, who are the right patients for this, what about the side effects, and what are we really supposed to be telling our patients in terms of, hey, this drug is great, maybe it's costs a lot of money. So I think there's a lot of discussions that where we as in the medical doctors are going to be having with these patients and family members pertaining to this drug. I don't think it's going to be a straightforward question and answer. And I think it has to be really individualized. And each doctor is going to have to spend a lot of time discussing this with their patient and family.